Experts estimate that serious mental illness impacts 1 in 5 families nationwide. In Montana, that translates to roughly 45,000 individuals.
As a family that struggles from mental illness, you feel so weak and so vulnerable. Like you can't fix them. You can't fix anything. You feel like all these systems are set up to fail you.
Severe disabling mental illnesses, as classified by the National Alliance on Mental Illness, or NAMI, are broken into several recognized diagnoses: major depression, schizophrenia, bipolar disorder, obsessive-compulsive disorder, panic disorder, borderline personality disorder, and the most recently recognized, post-traumatic stress disorder.
You know what to do if your kid is diagnosed with cancer, or if your kid gets a bad broken leg, or, God forbid, even a heart problem. You know what to do, basically. But people are not prepared and do not know what to do if one of their family members goes into a pretty significant mental health crisis.
In Montana, antiquated commitment laws, difficulty staffing services in rural areas, outdated thinking that ostracizes the mentally ill, and a scarcity of resources all combine into a perfect storm. In Montana's present mental health system of services, preventative options are almost non-existent. The majority of services are weighted toward the crisis end of the continuum. For many, the first care they receive for their mental illness comes at the state hospital in Warm Springs after an involuntary, court-ordered commitment.
I was trying to honor the Center for Mental Health, to dance for them in the powwow, and honor the people that go there, because mentally ill are kind of stronger than the normal people are. And it has a lot to do with power and strength, and all they got to do now is keep their heads up.
Thanks to the efforts of many communities around the state, the spectrum of mental health care services is changing. Join the independent record in examining the evolution toward a more complete, supportive continuum of care, both in the state of Montana and Helena in particular, throughout the next 5 weeks of coverage in both print and online.